Welcome to Life and Living. I'm Joanna Gagis. I am so pleased right now to be joined by Marc Milano, who is the chair of the Department of Emergency Medicine at Bayshore Community Hospital. That is part of the Meridian healthcare system. Welcome, Marc. How are you doing?
I'm doing great, and thank you, Joanna, for this opportunity. It's such a privilege to speak on a subject that I'm so passionate about.
And that subject is emergency care for children. Now, you see children in emergency situations all the time, unfortunately. What are most of these kids coming to the emergency department for? What are the reasons?
It really runs the gamut, but we see children with anything from a fever or simple injuries, all the way up to children who have terrible infections or life-threatening trauma.
What are the top five? Give us the top five reasons that kids go to the ER.
I'd say the first one is parental apprehension. But in truth, the conditions that we see most are things like fever, sore throat, upper respiratory infection, minor injuries, and then even things like, more severe injuries that can occur from car accidents or motor vehicle collisions.
You say parental apprehension is one of the biggest drivers of the reasons why parents bring their kids to the ER. Is there a time when parents should be more cautious and perhaps not bring the kid to the ER, or when you have those nerves and when you're concerned, do you just go? What do you say?
I've always said just go.
Why?
Well, the thing for me is that we were all instilled, from the beginning of time with a survival instinct. And if that survival instinct is triggered and you get that fight or flight response, that visceral feeling that something might be wrong, you should always get that checked out immediately.
Do parents know, do parents have a sense about their children and when something is right and when something is wrong?
I think they do. And I can tell you why I know that. Because before I was a father, I was a doctor. And for me, the way that I approach children now is completely different. I understand that the things that might have been happening at home before they got to the emergency department are very different than what we may see. So in fact, whereas when I see the child and the child looks well, there may have been a very different situation at home.
Explain that. So are you saying that what presents in a child may not be as bad as the circumstance actually was? Let's say a child had a bad slip and fall. Right. The child may not look that bad in the emergency room, but the parent saw the fall.
Absolutely. I can give a personal anecdote on that. Everyone is aware of a condition called SIDS or crib death. That's
Sudden infant death syndrome.
Exactly. And my son actually had something very similar to that. He had what's called a prolonged apneic episode. He stopped breathing for 15 minutes. And I did CPR on him while my wife drove us to the hospital. And by the time we got there, he was completely resuscitated. He was fine. And I can imagine what they were thinking when I walked in there in a panic that, what's going on? He looks great, he's pink, he's smiling, he's cooing, and he's drooling. But in fact, he was lifeless in my arms.
Oh my goodness, Marc. Yeah. So first of all, the fact that you were a healthcare professional, you were probably able to advocate for yourself in a different way than some parents would who don't have that background. You know the healthcare world, but for the rest of us, how do we go into that situation and say, listen, something is wrong, and how do we advocate for ourselves in the way we need to? Well,
the first thing is to try to clearly articulate what happened. What happened, how long it was going on for, what you saw. For instance, with children, what was their color like, what was their muscle tone like, things like that really sort of help us to understand what you were seeing, because we do want to believe what you tell us, and we really do rely on the information you give us, because sometimes what we see is different than what you saw at home.
When we do go to the ER, when we have that feeling, we listen to our intuition, we make the decision to go because we know that something just wasn't right. Do we need to be prepared for that visit, and what do we need to do?
Absolutely. I think the more information you bring to the visit, the better the visit's going to wind up, so that you can tell us all the medical history, immunization history, any medications, any allergies. I think it's a great idea to have those things written down, because in the heat of the moment, sometimes it's easy to forget those important details.
What are some of the things that we can do to prevent the visit to the emergency department? As someone who sees the kids come in, I'm sure you're thinking, oh, if you had only, or if I could just tell you, never do that again. What are the things that we should be doing as our laundry list?
When you're talking about preventable events, that things that we can't in any way keep from happening, I think about things like, fevers, infections that we can't do so much to prevent, although things like hand washing and general hygiene help. But it's the safety things that we talked about earlier related to child-proofing your home. So making sure that they don't access the sharp objects, or that the stairways are protected from falls. I think all those things. And then in the summer months, like we're entering now, we have to think about things like bicycle safety. So full safety gear, helmets, elbow pads, knee pads, and supervision. That's critical. And swimming pools. never let your child unattended anywhere near a swimming pool, because that's obviously a preventable catastrophe as well.
And it's interesting, how many people could be surrounding a swimming pool and not notice that a child is drowning? And drowning doesn't look like what most people think drowning looks like.
I've heard stories about these sort of near drowning events where literally there were 20 people within 5 feet of the child and no one was aware that it was happening. So it's just incredible vigilance that a parent has to have to keep their child safe.
You know, Mark, we talk about the rising cost of healthcare and what it means when people use or overuse emergency departments, and part of Obamacare is really getting people out of the emergency department, and yet here you are sitting in front of me telling us that we should be bringing our kids, under any circumstance, if we even have an inkling of a feeling, go to the emergency department. Are we contributing to the overall inflammation of the cost of healthcare?
Okay, first and foremost, keep in mind that the emergency department is the only portal of entry for many people into the healthcare system. There's still a substantial number of population in the United States that do not have health coverage of any sort. And then there are still a substantial number that have underinsurance that won't be accepted by a lot of private physicians. So as such, the safety net that the emergency department provides is a critical access to the healthcare system, number one. Number two, when you look at the numbers, the most generous estimates of healthcare spending on emergency care is upwards of 4 to 5%. So if you think about that in terms of the big picture, it's really not that huge of an expense.
All right, so that's a whole nother thing that I'm sure we could
Absolutely.
get into for quite a bit. But you know, one of the things that a lot of hospitals are doing is creating a delineation between what we call urgent care and emergency care. What is the difference, and how do we know if this situation requires emergency or urgent care?
So that's another good question, because we do have those tracks within our emergency departments. We have an urgent care or a fast track section. We also have the acute care section, and of course within the Meridian hospitals we have all pediatric emergency departments as well. So when you arrive, our triage process assigns you to the area that should give you the level of care that you need. Now, as a patient trying to decide whether or not you should come to the hospital or an urgent care center, there are multiple factors that come into play. One of which is access. Again, if you're not covered, most urgent care centers will require a fee up front. And some people don't have that to provide, so they need to come to the emergency department for care. But people can self-triage fairly effectively, and the one thing that we do rely on our urgent care center partners to do is to recognize conditions that are more severe, that do need to be sent up the hill to the emergency department, and we're very happy to receive those patients from them.
So important messages to all parents: be alert, be aware, watch your children very closely, and of course listen to those instincts. If you think something is wrong, trust your gut, bring them to the emergency room, and of course you'll be there guiding them through.
24/7, 365 waiting.
It never gets tiring, right, Mark?
Nope.
Never. Marc Milano, Chair of the Department of Emergency Medicine at Bayshore Community Hospital, once again part of the Meridian healthcare system. Thank you so much, Mark.
And I thank you.
Absolutely. And don't go anywhere, because there's more Life and Living coming up right after this.